The top stories tonight in Y News. National Capital Region now under less strict general community quarantine, says Malacanang. Meanwhile, Metro Manila mayors want the entire National Capital Region to be under general community quarantine until the end of 2020.
Filipino experts seeking more evidence on lingering COVID-19 symptoms among recoveries. Meanwhile, the public is advised to bathe upon reaching home as coronavirus lasts on the skin and hair for hours, according to experts.
The Department of Health admits their budget to buy COVID-19 vaccine is not yet enough. The House Small Committee approves 20 billion pesos worth of amendments in the lower chamber's version of the budget bill. Meanwhile, the delay in the Bayanihan to fund release is unfortunate, according to senators.
Sayang naman yung pinaghirapan natin sa Bayanihan 2. Huwag naman sana maging lip service.
The New Zealand Health Ministry confirms a case of new strain of coronavirus in Auckland. This case of new infection not linked to the August outbreak in the city.
In the know, how can drinking alcohol harm one's health? Good evening, Philippines and the world. Today is Monday, October 19, 2020. I am Jorlene Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news, Malacanang says the National Capital Region is now under less strict general community quarantine. Meanwhile, the Interagency Task Force against Coronavirus is looking at implementing GCQ in Metro Manila until December 2020. Our palace correspondent, Rosa Licons, tells us why.
More people are now allowed to go outdoors, and the passenger capacity of public transportation has been increased. The government also urges business establishments to conduct activities that will attract more customers. Also, more business sectors are permitted to reopen. Presidential spokesperson Harry Roque admits general community quarantine is less strict now in Metro Manila.
Tama po kayo, mas maluwag na GCQ ang pinapairal ngayon sa Metro Manila.
The further easing of quarantine restrictions is for economic recovery. Also, according to Secretary Roque, there are some government officials who agree with the suggestion of Metro Manila mayors to extend the general community quarantine period in the region until December. However, the decision still depends on the government's policy-making body against the coronavirus, the IATF. President Rodrigo Duterte is expected to announce his decision on the quarantine classification over NCR before November.
Well, yan po ang parang nabubuong consensus, pero siyempre po hindi ko po pwedeng pangunahan, no, because it is a collegial decision. Pero ang nangyayari po kasi ngayon, bagamat naka-GCQ ang Metro Manila, nagkakaroon po tayo ng mas malawak na pagbubukas ng mga industriya.
Roque adds anything is possible as to the quarantine classifications to be implemented in the National Capital Region. But one thing is for sure, the government will allow people to go back to work while strictly observing the minimum health standards. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
Metro Manila mayors want to shorten the curfew except the Navotas city government. Also, the NCR mayors seek to limit the age group allowed outdoors from 18 to 65 years old. Joanne Nano tells us why.
From the current 10 p.m. to 5 a.m. curfew implemented in the National Capital Region, the Metro Manila mayors have agreed to shorten the hours to only 12 a.m. until 4 a.m. But the Navotas city government still wants to implement longer curfew hours from 8 p.m. to 5 a.m. due to fears of resurgence of COVID-19 in the city. As of today, Navotas has only over 100 active cases out of the more than 5,000 total confirmed cases of COVID-19. Navotas is one of the most populated cities in Metro Manila. Meanwhile, the Metro Manila local chief executives also want to limit the age of authorized persons outside of residence or a poor from 18 to 65 years old.
Sinabi naman ng mga mayors natin na yung 18 up mas bagay na lumabas kasi nga at least yung 18 na legal na magtrabaho. Yung mga 15, 16 hindi naman po pwede magtrabaho yan. So mas more sila sa leisure, no?
Metro Manila mayors are also recommending the increase the capacity of places or worship to 30%. However, this will still have to be approved by the IATF, unlike curfew hours and limiting a poor, which can be decided by the local government.
Because according to the IATF resolution, the local governments may increase the age of young people that are allowed out. And the MMDA already decided it is 18 to 65. So in Metro Manila, it's 18 to 65. Number two, yung hours ng curfew, again, that's up to the local government. That's a recommendation of both the Cabinet and IATF. At nagdesisyon na po ang Metro Manila na 12 to 4, except pagdating ng December 1, it will be 12 to 3 to accommodate Simbang Gabi.
The possibility of the resumption of motorcycle taxi operations has also been discussed. The MMDA says that among the guidelines will be the requirement of using a barrier between the rider and the back rider. The Metro Manila mayors are also in favor of back riding among tricycles. Despite relaxed restrictions, the local chief executives reiterate that Metro Manila should remain under general community quarantine until the end of this year. They also urge the public to refrain from holding parties or any gatherings in celebration of the holiday season.
Wala pang guidelines ang IATF po, no? So pero iniinganyo natin na iwasan na. Kaya sa amin po, sa MMDA, si chairman po nag-declare na wala na kaming Christmas party. So we're encouraging everyone, no? At na wala na Christmas party o hindi payagan. Pero in case man, hopefully maglabas po ang IATF ng guidelines regarding sa mga Christmas parties.
Joanaro, UNTV News and Rescue. We serve the people, we give glory to God.
Filipino experts are seeking more evidence to prove what is called long COVID. Meanwhile, people who go outdoors are advised to take a bath right away upon reaching home. Our health correspondent Aiko Miguel explains why.
There are studies and evidence which show that people who have recovered from coronavirus infection still experiencing lingering symptoms of the disease. According to the DOH, there are also pieces of evidence in various countries that prove what is called as a long COVID. Experts in the Philippines, meanwhile, continue to gather information to prove their study.
Ito yung mga after mong makarecover, you still experience itong mga simptomas. And most common symptoms, no, that people would feel would be yung constant headache, yung nawawalan sila ng nahirapan sila matulog. Meron po na nagkakaroon din ng mga chest pains, especially for those 50 years old and above. Meron po yung parang feeling nila pagod na pagod sila. Tapos yung iba, yung loss of taste and loss of smell, matagal po bumalik ang kanilang pang-amoy at saka pang-lasa. Pinag-aaralan ho natin to sa ngayon, kinokolekta natin yung mga information at saka mga individuals who are experiencing this kind of symptoms para mailagay natin sa isang study, no, para magkaroon din ng ebidensya dito sa atin sa Pilipinas.
According to Undersecretary Vergere, people considered as COVID-19 recoveries are being monitored and advised to seek medical help once they experience symptoms of the disease again.
As to these recovered patients, they are instructed, no, after being tagged as recovered, that they should report, no, to their local health officers if ever, no, they would be experiencing set of symptoms which are related to COVID or any matter, no, or any health matter na kanilang irereklamo pagkatapos po nilang ma-recover.
It also appeared in a medical journal that coronavirus infection may last for hours on the skin.
This is why COVID-19 can be transmitted from an infected person if minimum health standards are not observed, like disinfection or washing of hands. The DOH is also aware of this study, so the public is advised to stay at home when there is no essential activity to do outdoors. Those who often go outdoors, especially essential workers, are advised to immediately take a bath once they reach their homes. They must wash their clothes right away and avoid interacting with people at home, especially with children, the elderly, and those who have underlying health conditions.
Lumabas last week, 28 hours daw sa skin. Kagabi, lumabas 8 hours na lang yata or 9 hours. So, sa lahat-lahat ng ito yung lahat na ating pinag-aaralan. And kung ano man po yung mga lumalabas na ebidensya ngayon, no, na tumatagal sa balat ng mas matagal, tumatagal sa objects na mas matagal, yun pa rin pong minimum health standards ang ipapaalala natin sa ating mga kababayan. Ano? Kapag uwi nyo po, wag muna kayo makipag-interact sa pamilya nyo. Dumiretso po kayo sa banyo, maligo po kayo. Even your hair, no? Not just the shower, magsabon din ng ulo, no? Para natatanggal din po kung anumang virus ang dumikit sa ating mga balat o sa ating mga buhok habang tayo ay nasa labas.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
A study finds that air passengers will have low exposure risk to COVID-19 if they wear a face mask. Gerlu Duriga explains why.
After months of research, U.S. Transportation Command (U.S. Transcom) released the results of their studies about commercial aircraft cabin aerosol dispersion tests that aim to measure the overall exposure risk from aerosolized pathogens like COVID-19. According to Vice Admin D. Mewborn, U.S. Transportation Command Deputy Commander, when masks are worn, there's a low risk of exposure to COVID-19.
Within the scope of the test, the analysis showed an overall low exposure risk on these aircraft from airborne pathogens like COVID-19.
In their study, researchers conducted more than 300 tests over 8 days inside Boeing 747 and 777 jetliners. They used mannequins with and without face masks sat in various seats of the aircraft, while fluorescent tracer particles were released in intervals of 2 seconds to stimulate breathing for a minute during ground and in-flight tests. Real-time fluorescent particle sensors were placed throughout the aircraft at the breathing zone of the passengers to measure concentration over time. Based on the results, 99.7% of the particles were eliminated by the ventilation system of the aircraft before it got close to the nearest passenger, and 99.99% of the contaminants were also eliminated before they get close to the nearest 40 passengers. Despite the promising result, Mewborn reminded the public that his study has a few limitations. Specifically, it only considered a single infected passenger and did not attempt to gather data reflecting passenger movement inside the cabin. Gerlu Duriga, UNTV News and Rescue. We serve the people, we give glory to God.
The Municipal Risk Reduction and Management Office of Apalit, Pampanga received additional personal protective equipment from Members Church of God International and UNTV, for which the group is thankful. Leslie Huidem tells us why.
The Apalit Municipal Risk Reduction and Management Office is on the front line of the battle against COVID-19 in the town. But now, 8 months since the health crisis began, the group is experiencing a lack of personal protective equipment.
Mga nagtatrabaho sa iba't ibang lugar, uuwi dito, nakakakuha ng virus. Pagdating dito, mga ganun ang nangyayaring sitwasyon ngayon eh.
In April, UNTV and MCGI donated 43 PPEs to the Apalit MDRRMO.
Ang ginagawa po namin, pagdating namin sa compact po namin sa Fishport, operational office namin ngayon, yung mga PPEs na pwedeng washable po, binababad na po namin sa disinfect na sabon, tapos lalabahan, bibilad. Pag natuyo po, yun po gagamitin namin po ulit. Ganun lang po ang ginagawa namin.
To address the MDRRMO's need for more PPEs, Members Church of God International and UNTV once again donated PPEs for the frontliners.
Kaya malaking tulong tong bigay na PPE ng ating kapati sa ADD, UNTV. Maraming salamat po sa inyo. Lagi namin kayong katulong. Kasi kung wala kayo, medyo mas magaan yung trabaho pag nandyan kayo. It's a pity na siguro mga 2 taon pa tayo magiging normal. But pagtulungan natin paano yung new normal.
The group received 50 PPEs from UNTV and MCGI. Among the MDRRMO's task is to transport COVID-19 positive patients to health facilities and disinfect various areas in Apalit to stem the spread of the virus. Leslie Widem, UNTV News and Rescue. We serve the people. We give glory to God.
Meanwhile, the country's Department of Health says that 2,638 new cases were reported today, raising the total confirmed cases of coronavirus infection in the Philippines to 359,169. That's the 20th largest caseload globally, next to Indonesia's more than 365,000. Quezon City reported the most new cases today among highly urbanized cities and provinces in the country. The total active cases have gone down to over 42,000. Of that number, 83.1% are in mild condition, 11.3% are asymptomatic. We have lost 26 more patients. But through our fervent prayers, medical interventions, and sacrifices of our medical frontliners, 226 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 310,303. That's the 14th most number of patients who recovered from the infectious disease as of today. Thanks be to God.
Let's now take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of more than 40 million confirmed cases in 189 countries, regions, and sovereignties. That's after more than 200,000 confirmed COVID-19 cases were reported across various countries. The fast-spreading disease has claimed over 1.1 million lives, while a total of more than 27.5 million patients across the globe have recovered from the new coronavirus infection. Thanks be to God. The Philippine National Police orders ground commanders to coordinate with local governments on travel protocols implemented within their jurisdictions. Our police correspondent, Lea Ilagan, tells us why.
The Interagency Task Force has lifted restrictions on the movement of people in the country. Joint Task Force Coronavirus Shield Commander, Police Lieutenant General Guillermo Eleazar says the PNP is implementing checkpoints. That's why it is important for them to know the decision of local governments on the travel restriction. General Eleazar adds they leave to the decision on the implementation of the travel restrictions to the LGUs, especially on people who are not included on the list of authorized persons outside of residence and locally stranded individuals now that the IATF permits 15 to 65 years olds to go outside their houses. Eleazar further says that even though the League of Provinces of the Philippines head Marinduque Governor Presbitero Velasco stressed the need to implement local quarantines to ensure the safety of their constituents from possible COVID-19 transmission from travelers. Some LGUs might want to lift the travel restriction for the benefit of their economies.
Ibig sabihin nun, kung ang isang probinsya o area ay wala ng restriction, hindi na kailangan ng travel authority kung pupunta doon.
But Eleazar reminds the public to follow the health protocols and policies implemented by the local governments of the areas they pass through or travel to.
Dahil kung pupuntahan nyo or yung dadaanan nyo isa man doon ay restricted pa rin o meron pa rin silang restriction like mag-require ng travel authority, ay kailangan na mag-secure kayo ng kanilang requirement.
In the meantime, there will be a status quo on the implementation of travel restrictions unless certain LGUs signify intention to immediately comply with the IATF unrestricted travel policy. Some of the provinces with entry moratorium of locally stranded individuals are Guimaras until October 25, Janiway Iloilo until November 2, Oton Iloilo until October 25, Pavia Iloilo until November 2, and Lanao del Sur until October 31. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
The Department of Health admits their budget to buy COVID-19 vaccine is not yet enough. Aiko Miguel tells us why.
The government still needs 10.5 billion pesos to suffice the budget for the procurement of COVID-19 vaccines for Filipinos. According to Undersecretary Maria Rosario Vergere, the government needs 12.1 billion pesos for the 20 million indigent Filipinos who President Duterte said should be prioritized in the immunization against coronavirus.
Sa Congress naman, we heard from our lawmakers na talagang they're committing to help us, no, for us to get that additional 10.5 billion na kailangan so that we can at least have this 20% of the population prioritized for the vaccine.
According to the DOH, they are finding ways to source the needed budget. Currently, they have only 2.5 billion pesos allotted for the vaccine next year. With that fund, almost 4 million Filipinos will be vaccinated. Health Secretary Francisco Duque III mentioned at a Senate hearing this October that they will file a bank loan for the funding. The DOH is also considering to strike a financing deal with the Development Bank of the Philippines and the Land Bank of the Philippines to allow the Department of Trade and Industry to procure vaccines, which the DOH will pay for a period of 3 months.
Pagka re-enacted, ang tatamaan dito yung COVID response. Malaki po ang tama nito sa COVID response. Tandaan po natin, ang budget natin ng 2021, meron po tayong 27% na pagtaas. At kapag na-reenact ito, we cannot afford because under the circumstances, kinakailangan talaga ng karagdagan.
Also, the DOH explains that in the Omnibus Guidelines, RT-PCR test is still considered as the gold standard for COVID-19 testing. But rapid antigen testing is also required in the destination country of outbound Filipinos or foreign travelers.
So if the receiving country would state in their requirements that they would need an RT-PCR test before a person leaves or before they travel going to their country, and then the traveler should be able to comply with that. Na kapag mga close contacts of those people in the community, especially during outbreaks, we can use antigen, and also for hospitals for faster turnaround time, gagamitin natin yan.
According to the DOH, if a positive result comes from antigen testing, then an individual is a confirmed COVID-19 positive patient. But if a result appears to be negative, then it should still be confirmed through RT-PCR testing. The DOH explains it is included in the Omnibus Guidelines issued last week that COVID-19 testing methods should be used depending on the population and classification of an individual, such as returning residents, tourists, domestic travelers, and international travelers. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
One of the members of the small committee formed by the House of Representatives to tackle amendments to the proposed national budget is positive the lower chamber of Congress can transmit a copy of the House's version of the bill on time. Vincent Arboleda will tell us why.
The House version of the proposed 2021 national budget has finally been finished, according to Albay's 2nd District Representative Joey Salceda. Salceda is one of the members of the small committee formed by the House of Representatives to tackle amendments to the proposed national budget coming from executive departments and lawmakers. Salceda says that no individual amendments from lawmakers were included in the final House version of the 2021 budget.
As the small group composed of led by Majority Leader Romualdez had a consensus to consider only institutional amendments and departmental errata, and consider individual amendments only during the BICAM.
Included in the 20 billion peso amendment are the 500 million pesos for energy governance and self-sufficiency, 5.5 billion pesos added for the procurement of the COVID-19 vaccine, 2 billion pesos for health facility enhancement program, 300 million pesos for mental health, 4 billion pesos was allotted for DOLE to help displaced workers. Another 2 billion pesos allotted for the Armed Forces of the Philippines to acquire C-130 planes. 2 billion pesos for mobility assets of the Philippine National Police, another 2 billion pesos for pandemic assistance to inflicted families under the Department of Social Welfare and Development, and 1.7 billion pesos for DepEd's Internet. Salceda adds the fund will be sourced from several projects of the Department of Transportation. Meanwhile, Congressman Salceda clarifies that the 5.5 billion peso additional budget to procure doses of COVID-19 vaccine is just enough since additional funds can also be sourced from the 20 billion peso Disaster Response Fund.
Pwedeng gamitin yung NDRRMF na 20 billion fund. Because pandemic is defined under the Public Act 10121 as a disaster.
The 2nd District of Albay representative further says that individual amendments will be tackled in the BICAM. With this development, Salceda believes that the lower house can transmit the soft copy of the House version of the 2021 budget by October 28 or 9 days from today. Salceda adds that there is no chance for a reenacted budget to happen. Vincent Arboleda, UNTV, News and Rescue. We serve the people. We give glory to God.
Several senators want to urge the Department of Budget and Management and the Office of the President to fast-track the release of the funds from the Bayanihan to Recover as One Act, also known as the Bayanihan 2, over a month since it was signed into law by President Rodrigo Duterte. This was after it was found out during the Senate Finance Subcommittee on the proposed 2021 budget of the Department of Agriculture that the 24 billion pesos allocated for the agency is yet to be released. According to Agriculture Undersecretary Ariel Cayanan, they have submitted the documents for the DBM for the 16 billion pesos of the fund. DBM Director Cristina Clasara explained they have been processing the submissions that are also subject to the review of their higher-ups and approval of the President. The official said it may be endorsed to the Office of the President this week and vowed that the process for the release of the Bayanihan 2 funds will be quick. Meanwhile, Senate President Pro Tempore Ralph Recto also said that only 6 billion pesos of the 165 billion peso fund of the Bayanihan 2 has been released.
We can move to urge whichever entity or department to immediately cause the release of these funds. So 2 buwan na ho ito eh.
Sayang naman yung pinaghirapan natin sa Bayanihan 2. Huwag naman sana maging lip service.
I guess it's the job of the higher up of the Senate to go to Malacanang and lobby for the release.
Meanwhile, in the budget hearing on the proposed budget of the Department of Tourism, senators also found out that the 10 billion peso allocation for the tourism sector has yet to be released. Tourism Secretary Bernadette Romulo Puyat said part of the budget is intended for the loan programs for around 5,000 micro, small, and medium enterprises or MSMEs that were hit by the pandemic. Based on the law, the Bayanihan 2 Act is effective until the adjournment of the 18th Congress, which is on December 19, 2020. Senator Recto suggested to extend the validity of the law, while Senate Majority Leader Miguel Zubiri said he will take this up to the Joint Congressional Oversight Committee. In a text message to UNTV News, DBM Secretary Wendell Avizado said they immediately act on the requests of agencies as soon as they receive them, just like what they did to other departments that have already received their allocations. He said all secretaries know the rules that they have to submit their budget requests before the DBM can release the needed funds. Avisado adds agencies should not be quick to point the blame to the DBM on the delay in their budget requests. Malacanang insists that the publication of President Rodrigo Duterte's Statement of Assets, Liabilities, and Net Worth or SALN depends on the Office of the Ombudsman. This is the response of the palace when questioned if the public would still be able to know about the wealth records of the chief executive. Presidential spokesperson Harry Roque advises the public to follow the regulations imposed by the Ombudsman to access the SALN of public officials. files. Unlike the past administrations, the ombudsman is no longer allowing the public to see the copies of the SAL-Ns. It can only be provided to a requester if he or she is the declarant or the person who filed the SAL-N or the duly representative of the declaration. There is a court order or the request is made by the Ombudsman's Field Investigation Units.
May bago pong guidelines na sinusunod ang Office of the Ombudsman. Siguro naman po dahil co-equal, hindi naman co-equal, kung hindi constitutional body yung Ombudsman, dapat naman po sundin natin yung kanilang mga guidelines.
The Duterte administration stands firm that the Philippines' position will not be compromised if there will be a joint oil exploration with China in the West Philippine Sea. This is in relation with the country's arbitral award on the disputed territory against China. Recently, President Rodrigo Dutertes approved the recommendation of the Department of Energy to lift the suspension and issue again resume to work notice for service contractors for oil exploration in the West Philippine Sea.
In no way it weakens. First, this lifting of the moratorium is an exercise of our sovereign rights. No? Ginagawa na po natin yan. So, in no way it weakens the arbitral decision. And our MOU to do to explore a joint development program, no, or cooperation with China, it's in no way that it weakens or giving away our sovereign rights.
Although sovereign rights is defined as the exclusive right, that exclusive right may be shared by others. The decision to share it is part of the sovereign rights.
The Senate Committee on Health has approved a proposed measure seeking to change the chairmanship of PhilHealth. Senate Bill number 1829 aims to amend Section 13 of the Universal Healthcare Law to replace the Health Secretary by the Secretary of Finance as the PhilHealth's chairman of the board. During the committee hearing earlier today, Health Secretary Francisco Duque III himself expressed support on the measure. When asked by senators, Duque admitted that he was not able to participate in the board meetings for 4 months due to heavy workload after he was assigned as the chair of the Interagency Task Force Against Emerging Infectious Diseases, or IATF-EID.
We welcome the proposal to strengthen fiscal management measures that shall be made possible through a chairmanship by the Secretary of Finance. I think the secretaries as ex officio members of the board would really love to attend the meetings as much as they can. But, the cabinet secretaries are extremely busy national government officials. I chair or I am a member of 69 task forces, academies, commissions, committees, name it. So this is just overwhelming.
Meanwhile, Finance Secretary Carlos Dominguez himself said it would be a great challenge as he also chairs various boards and committees. But he vowed that he will do his best if he gets designated as PhilHealth's chairman of the board.
We are prepared to implement a new IT system, which is very, very important to managing this institution. If the job is given to me, which I do not seek, I will do my best to do it, to implement it.
Senate Committee on Health Chair Senator Christopher Bongo also supported the measure, noting that the Finance Secretary is only appropriate to sit as chairman of the board of PhilHealth, which is an insurance corporation. He adds a proper fund management is needed to avoid issues just like the non-payment of balance of PhilHealth to the Philippine Red Cross amounting to almost 1 billion pesos. Go said he met with Executive Secretary Salvador Medialdea, Philippine Red Cross Chairman Senator Richard Gordon, and PhilHealth President and CEO Dante Gueran over the matter, and assured that PhilHealth will settle the amount with the PRC.
A private organization began its week-long cleanup program in Manila City. The nation's capital city also received waste bins made of single-use plastic as well as cleaning tools and equipment. Asher Kadapan Jr. explains why.
The Junior Chamber International or JCI Manila today began the 5 programs for its Cleanup Week 2020 in the city of Manila. The group aims to empower people to create a positive impact to society and community. The group members target to finish their projects within the week, with the country's capital city as this year's beneficiary. As a start, the group donated 100 mobile waste bins made of single-use plastic.
So we wanted to come in as JCI Manila and help the city of Manila by donating more waste bins to help people, of course, collect trash and recycle these trash. But we can use it for something else, like maybe school chairs or benches, or again, more waste bins.
JCI Manila hopes to encourage and inspire residents to segregate their trash, particularly plastic materials.
The idea is taking these single-use plastic sachets, and instead of ending up in the landfill or worse, in the esteros or the ocean, we take them and we turn them into something useful.
The organization also learned that out of around 900 barangays in Manila City, only about 300 have appropriate tools for cleaning their surroundings, especially creeks. So they decided to donate as well cleaning tools and equipment to the Department of Public Service or DPS and local government units in Vitas community in Tondo.
Bibigyan kami ng magandang gamit, mas maganda pa sa mga dating gamit. Nagpapasalamat ako, malaking tulong sa nasasakupan ko to.
JCI Manila is set to execute more of their projects in the following days. The group also aspires to conduct next year the Cleanup Week program in the entire National Capital Region. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Now, here's a glimpse of what's the weather like in parts of the country. The trough of Tropical Depression Pepito will affect parts of the country. State Weather Bureau Pagasa says as of 3 p.m. today, Pepito was located 430 kilometers east of Virac, Catanduanes. It has maximum sustained winds of 55 kilometers per hour near the center and gustiness of up to 70 kilometers per hour, moving west-northwestward at 20 kilometers per hour. The tropical cyclone wind signal number 1 is raised over Isabela, Aurora, Quirino, the eastern portion of Kalinga, the eastern portion of Mountain Province, Ifugao, Nueva Vizcaya, Nueva Ecija, and the northern portion of Quezon. The trough of the tropical depression will bring cloudy skies with scattered rain showers and thunderstorms over Visayas, Mindanao, Mimaropa, and Bicol region. Meanwhile, Ilocos region, Cordillera Administrative region, Cagayan Valley, and Central Luzon will experience partly cloudy to cloudy skies with rain showers due to the northeasterly surface wind flow, while Metro Manila and the rest of Luzon will experience partly cloudy to cloudy skies with isolated rain showers due to localized thunderstorms. Possible flash floods or landslides may occur during severe thunderstorms. No tropical cyclone advisory is issued.
Petitioners to the anti-terrorism law asked the Supreme Court to issue a temporary restraining order to the implementation of the law. Dante Amento will tell us why live. Yes, Dante, go ahead.
Diego, various individuals and groups plan to file their petitions against the implementing rules and regulations of the anti-terrorism law released last week. Bayan Muna Representative Carlos Zarate says they also want the Supreme Court to issue a temporary restraining order to stop the implementation of the law signed by President Rodrigo Dutertes on July 3. Here's what he said about this matter.
Pag-aaralan ng Makabayan Block, especially dahil nilabas na nga itong IRR, kung magsasapa ng separate petition to nullify and declare unconstitutional itong IRR or just a supplemental petition.
Kabataan Party List Representative Sara Ilago, on the other hand, worries that human rights violations might increase, such as the arrest and detainment for several days of people labeled as terrorists even without a warrant of arrest.
ang pinakakinababahala natin, wala pa mga anti-terror law, tuloy-tuloy na talaga yung pananalasa. Hindi lang sa mga karapatan ng mga kabataan na makapagsalita, makapagpahayag ng kanilang mga saloobin.
Petitioners challenge the provision of warrantless arrest by mere suspicion that will be subject of some abuse by authorities. But Antiterrorism Council spokesperson Undersecretary Adrian Sugay says in the IRR, mere suspicion will not be used as basis of warrantless arrest. Authorities or law enforcers will still consider probable cause in conducting an arrest based on Rule 9.2 of the IRR. The IRR limits the warrantless arrest in situations such as if caught in act attempting to commit an offense or a prisoner who has escaped from a correctional or penal establishment. The IRR also requires law enforcers to submit an affidavit to the Antiterrorism Council to secure authorization before conducting any arrest. Under the law, a suspected terrorist can be detained for 2 weeks up to 24 days, allegedly without any violation of the law. Back to you, Diego.
Yes, Dante, what do the implementing rules and regulations of the law require after certain individuals suspected to be terrorists are arrested? Do they still need to be presented before the court or the judge?
Yes, Diego, the Anti-Terrorism Act and its implementing rules and regulations do not require to bring arrested individuals before the court or a judge. What the law and the IRR ask is after taking custody of the suspected persons, either the law enforcers or military personnel shall notify in writing the judge of the nearest court for a period not exceeding 48 hours. Diego.
Thank you very much for that report, Dante Amento.
And for the news abroad, here's Kath Dumaraos reporting live from Bangkok, Thailand.
3 truck drivers from Myanmar were found positive of the coronavirus disease after entering Thailand last October 9 to pick up some goods from a local market in Tak Province, a place in the country bordering Myanmar. Out of more than 4,000 people who were tested for the virus in the area, 2 Myanmar nationals, a 53-year-old woman and her 63-year-old husband, tested positive. Both are asymptomatic and are now receiving treatment in hospital. After the initial round of testing, the couple's daughter, niece, and nephew were also found positive of the virus last October 16. Tak Province has now closed its border with Myanmar as a preventive measure. The Thai government reported 5 new imported cases today, taking the total number of infections to 3,691, with 3,488 recovered. 144 are still in hospital, and the death toll remains at 59.